speakers will be Naheed Dosani and Stephen Pomedli. Naheed and Stephen are second-year family medicine residents with the Department of Family and Community Medicine at the University of Toronto. Naheed is passionate about the social determinants of health, inner-city health, global health, and social media. And then I saw them both twittering and working away as I was sitting beside them. Stephen is particularly interested in health systems, policies, and processes, and is engaged in healthcare innovation through technology and social media. They will also be delivering a presentation on crowdsourcing and collaborating at the Quality Forum. So Naheed and Stephen, and we'll get you started.
Here goes nothing. All right, good to go. Let's do this. As physicians, we are privileged to be able to walk alongside patients on their journeys through the healthcare system. A huge part of this involves communication, whether delivering an ultrasound result to a nervous pregnant mother or discussing an intricate case with a specialist hundreds of kilometers away.
Healthcare sometimes seems like a dinosaur, slow to embrace new modes of communication. However, as more and more people want to engage with their healthcare in novel ways, we are starting to see new types of conversations that are happening across the country.
Information technology theory tells us that the value of a network increases exponentially as the number of connected users in the network rises. With the unprecedented growth in the internet and mobile connectivity in Canada over the last decade, we now have a hugely valuable network at our disposal.
So how do we harness the power of this network? It's by connecting patients, providers, and the public. We have the capacity to break down traditional boundaries like never before and facilitate connections both within these groups and among them, including our celebrity there. It's starting to happen now.
But providing patient care as a physician can sometimes feel isolating. In most cases, we work and operate in geographical, institutional, and specialty-specific silos. This hinders patient care. Increased connectivity forges the lines of communication and can facilitate collaborative, seamless, patient-centered care. Open online forums like Twitter provides an accessible landscape to share evidence and opinions. For example, urologists from all over the world use the Urology Journal Club hashtag to share the latest advances in the field and to discuss the real-life applications to patient care. Similarly, several provinces have now adopted direct messaging systems to link healthcare providers. Now, we're able to communicate directly with the whole care team, including pharmacists, therapists, dietitians, and others. By breaking down barriers, the care we deliver can be more efficient, better coordinated, and of the highest quality.
Now, when it comes to communicating with patients, we've historically had one way of doing things, with patients usually traveling to clinics or hospitals during working hours to receive care. With patients plugged into the network more than ever, new avenues can complement these face-to-face interactions, giving patients more flexibility and opportunities for self-management. We've got more than one way to do things now. Using direct messaging platforms, providers can respond to patient questions or requests without the need for phone tag or in-person visits in many cases. Similarly, providers can send targeted information to specific patients. Imagine receiving a text message when a new vaccine for patients your age is available at your clinic. In addition, telemedicine, while not a new innovation by any means, is now increasingly powerful and practical given the current scope of internet connectivity. For example, care teams in rural areas can troubleshoot complicated dialysis units for kidney disease patients, supporting highly specialized care that takes advantage of network connections in patients' homes.
Aside from interacting with colleagues and patients, healthcare providers are eager to connect with an engaged public around topics related to health. By moving beyond the ivory towers of medical associations and hospital institutions, the dialogue becomes richer by engaging a public coming from different backgrounds with different perspectives and values. For example, outraged by recent cuts to the interim federal health program, a safety net for the healthcare of vulnerable refugees, healthcare providers utilize social media to mobilize others. These efforts gave momentum to a national movement, empowering public demonstrations across Canada. The ease to access these channels for online advocacy gave concerned citizens and refugees a voice in this very important dialogue. There's also growing recognition that the public is keen to participate in meaningful exchanges with providers about health. These discussions are happening all the time on websites like healthydebate.ca, where providers, patients, and the public can engage in discussions about issues that shape our health today.
Now, patients have a huge amount to benefit from being connected to other patients, as we all know. The ease of online communication lets patients turn to each other for support from their home 24/7. These support networks are bringing together individuals with similar illnesses, challenges, and disease experiences like never before. Websites like Patients Like Me allow patients to publicly or anonymously describe their disease experiences, compare treatment successes and failures, and find a community that feels right for them. These types of communities have also exploded on Facebook and Twitter, helping patients exchange gluten-free recipes for celiac disease or share the woes of new therapies used to treat Crohn's disease. These aren't necessarily substitutions for usual care, but can be key adjuncts to enhance patient-directed care, self-management, and improve quality of life and well-being.
Given that poor and vulnerably housed populations have inadequate social supports, they too can significantly benefit from virtual support networks. When we see patients, along with the usual medications and in-person follow-ups, we often prescribe a visit to websites like these or online support groups.
So we've seen the possibilities. The network is primed and ready for actualization. But what is holding us back from taking real advantage of this potential? The perennial concerns around privacy and security can be appropriately managed, as they are every day within the healthcare sector and in many other industries. We can transfer money between banks on our phones. It shouldn't be a miracle to look up our cholesterol results or message our doctors in the same way.
Incentives need to recognize the value added by enhanced communication. As a system, we need to embrace change if we are to reap these benefits and be open to different care modalities, processes, and modes of reimbursement. Now is a time for action, not excuses.
On the cusp of our careers, we are really excited for the future provided by this network of connected patients, providers, and ultimately people. Our hope for the future is that our fellow health professionals, along with payers, the public, and patients, will work together to usher in this new era of communication and collaboration. Thank you.